Good afternoon, everybody. Welcome to the Caregiver Resource Center Orange County monthly live stream series. So my name is Peter Nguyen. I am a family consultant with the Caregiver Resource Center. So today we will talk about Medicare Essentials presented by HICAP. Before we go to the actual topic of the day, first, please allow me to just briefly share about our history, our services, of what we can do to family caregivers in residing in Orange County. Okay, so quick background on our history. We have been around since 1988, serving Orange County residents um, that dealing with family caregiving's stress and duties. In Orange County, we are a program of St. Jude Community Services under Providence St. Joseph Health Community Health Investment. We one of the 11 centers of the California Caregiver Resource Center system. What that means is that in our state, there are 11 centers providing support to family caregivers like ourselves. For example, if you live in LA County, Riverside County, San Diego County, there is a center like us that is available to serve people who live in those counties respectively. And if you need contact of those counties, you can always call us, and then we can also we can share the information for you to contact with those counties with those caregiver resource centers. And we are funded by the Federal Older Americans Act and Family Caregiver Support Program, basically funded by state and federal government. So who are we? We are a trusted partner for Orange County families coping with physical, emotional, and financial responsibilities of caregiving. Our mission is to increase the quality of life of caregivers by helping families and communities master the challenges of caregiving. I mean, the word master can be a big word, but it's saying that basically it's saying improving, managing, of challenging of caregiving that family members are going through on a day-to-day basis. So this is an overview of our services, and due to time, I can't go into detail much. However, at the end of the slide, you can see our contact number. Please feel free to call, and then we can all elaborate more on the services. So what we provide is free services to family caregivers, including support groups. We have meeting on Zoom, virtual meeting, and also in-person meeting to provide that space and opportunities for family caregivers to come together and connect it and get that emotional support, which to us is very important and crucial. Next, we provide caregiver assessment and care planning. So once you become a client with our center, we will assign you a staff like myself. And what are my job is to help provide a caregiving assessment. And after the assessment, I can help with care planning in terms of what can be done or what are available for short term and what is that like for long term, for example. And next, we provide education workshop, training. This is an example of an education event, a live stream, and we have ongoing events that you can check out on our website for upcoming events. Most events are offered on virtually on Zoom, so you can feel free to register for those classes that you are interested, and you can join us, on the event day. Counseling, we provide short-term support counseling for family caregivers dealing with specific caregiving related issues. Specialized information. So as one of my job too is to provide my client with specific information and resources pertaining to their needs, to the caregiver's needs. So we try not to give a like just random resource or a list of resource, but we try to help to narrow down the information and be specific to help guide the family to guide the resources, because sometimes it can be overwhelming if you receive a lot of many things and you may not know how to go about those resources. And last but not least, and actually a very important service we provide is called respite assistance. For those that may not know, respite is just a term for taking a break. So we want to provide the caregivers a chance to take a break from caregiving, because oftentimes family caregivers share with us that they experiencing caregiver burnout, caregiver fatigue, caregiver exhaustions, and then they never have a chance to take like a real break from a day-to-day caregiving responsibilities. So when funding are available, we can help a family caregiver to have that opportunity to take a break, to rejuvenate, to relax, to take care of themselves, to focus on things that they care about, but maybe lack of time, lack of help, and they don't have a chance to really ever to focus on themselves. So that those in a nutshell that what we are doing in terms of services that we provide for family caregivers. And as I talk about respite care and take a break, we like to share this 50 ways to take a break postcard. Is very useful, especially when you stress out and may not have an idea of how to take a break. So this might be helpful when you look at this postcard. It's just giving a lot of ideas of things you can do quickly, that free, and also and that also can be doable as well. So we can also share this if you are interested. You can contact us, and then we can mail or email this to you. So this is a slide that's showing you our contact information and where we at. So we are a block from basically at the intersection at St. Jude Medical Center Hospital. Two phone numbers for you to call us: the toll-free 800 number and the local 714 area code phone number, and then our website. When you're on our website, you can browse our support group calendar, you can browse our education calendar, upcoming events, and then many more information and resources that are helpful to family caregivers. And there you go. That's the link, direct link to the classes page on our website. Once again, any specific question about our services that I just explained, please feel free to call us. We open from 8 to 5, Monday to Friday. Um, Within those hours, we have an intake social worker that is responsible to help with question concern about caregivings that you can call, and then we will address any of those concerns within the best of our ability. So with no further ado, I want to introduce to the audience today Beatrice. She is with the Council on Aging, and she works for the HICAP program. She will, and then thank you so much for your time, Beatrice, to be with us today, to present with us, within about 30 minutes time about what HICAP is, what Medicare is. So for those of you that maybe have question or may need support with this, then you can reach out to HICAP Council on Aging for the support. So Beatrice, go ahead and take it away.
Thank you so much, Peter, and good afternoon to everyone out there watching us today. My name is Beatrice Nunez. I am one of the community educators for HICAP in Orange County. HICAP stands for Health Insurance Counseling and Advocacy Program, and we're here today to talk a little bit about the HICAP services available to you in your area, as well as helping you understand a little bit about Medicare basics. So we'll go ahead and get started. Thank you. And once again, HICAP stands for Health Insurance Counseling and Advocacy Program. And nationally, we are known as the State Health Insurance and Assistance Program. So what HICAP does is we essentially provide free and unbiased Medicare counseling. And we are state and federally funded. And each county has a HICAP office available in their service area. So if you live in Orange County, there's a HICAP office there. LA County will have their own, San Diego, etc. So what we provide is counseling in person in Orange County, and we also do it over the phone. And we provide educational seminar like today and workshops throughout the community. So in Orange County, we visit a lot of the community centers, whether it be in San Juan Capistrano, all the way up to Yerba Linda or La Habra. Services are free. We provide unbiased information, and we have services available in multiple languages. HICAP does not sell or recommend any insurance product, and we help navigate Medicare information, and we provide an understanding of how your Medicare coverage can work with other coordination benefits. So if you have Medicare and other insurance, how that would work together. We can help explain how Medicare parts work and also help to see if you apply for programs that can help save you money. And we also address coverage issues or claim issues. So if there's a denial in a medication you're taking or a denial in receiving a wheelchair, etc., we are the third neutral party that can assist with those types of appeals. We also help individuals identify and report Medicare fraud. Medicare fraud is prevalent in the community, and our job is to help individuals understand how they can protect themselves from that occurring, from Medicare fraud occurring, and also if they do fall victims of Medicare fraud, how they can go about and report it. Next, please. So today we're going to be talking very briefly on eligibility and enrollment, Medicare parts. So we'll be going over Part A, B, C, and D, coverage options and plans available, resources. We'll talk a little bit about Medicare fraud and abuse, and I hope to be able to answer some of your questions that you may have today for us. Next, please. So let's start with what Medicare is. Medicare is a federal government health insurance program, and it provides health insurance for people who are ages 65 years or older, or for people under 65 with certain disabilities, and it is managed by two federal government health agencies, And one of the agencies that handles the enrollment as well as the monthly premiums for your Medicare is the Social Security Administration Office. They're in charge of enrolling you into Medicare A and Medicare Part B. Now, once you are enrolled into Medicare A and B, your benefits are going to be administered by Centers for Medicare and Medicaid Services, also known as CMS. Next, please. So let's talk a little bit about eligibility requirements. Next. And once again, you must be of age or on disability. So in order to be of age, you must be 65 years or older, or you could be under 65 with a disability, receiving disability benefits from the Social Security Administration Office or the Railroad Retirement. You can also be diagnosed with amyotrophic lateral sclerosis, also known as ALS, or diagnosed with end-stage renal disease, known as ESRD. So that's one component, be of age or be on disability. The second component requires the individual to be a U.S. citizen or a lawful permanent resident residing in the United States for at least 5 consecutive years. So in order to be Medicare eligible, you must meet both criterias. Next slide, please. So let's talk a little bit about enrolling. How do you enroll in Medicare? Where do you go? And when do you enroll? So there's two methods to enrollment when it comes to Medicare. Some individuals will automatically be enrolled, meaning that they don't have to do anything. They're going to receive their Medicare card in the mail prior to their 65th birthday. This occurs because some people are receiving Social Security benefits or Railroad Retirement Board benefits prior to their 65th birthday. So once they turn 65, they should have gotten a Medicare card in the mail. It is also automatic for people who are receiving Social Security disability benefits. Individuals receiving Social Security uh, disability benefits will receive their Medicare card after 24 months of being on Social Security disability. And individuals who are diagnosed with ALS, amyotrophic lateral sclerosis, will be able to begin their Medicare benefits the month that their Social Security disability benefits start. All others must take action and enroll into Medicare. So let's take a look at that, what that looks like. When we look at enrollment into Medicare, once again, you will be contacting the Social Security Administration office. You can enroll online, over the phone, or in person. So you'll be able to see the online website. Please make sure it ends with .gov, okay? And then that is the national phone number that you can call to contact your local Social Security office. And you can also visit your local Social Security office. However, you may want to book an appointment. Next, please. When we talk about enrollment periods, this means that we're discussing when you can enroll. And people on Medicare or people who want to enroll into Medicare have three options in enrollment. The first option is called Initial Enrollment Period, also known as IEP. And this is when somebody is turning 65. So somebody who is turning 65 has a 7-month window in order to enroll into Medicare. They can start the enrollment process 3 months prior to their birthday month. They can enroll the month that they turn 65 and 3 months after that. That is considered the initial enrollment period. For special enrollment period, these are for folks or individuals that have decided to continue working and they are under an employer group health plan. For the special enrollment to take place, if somebody is 65 plus, they must have at least 20 employees or more on the employer group health plan for this to work. If somebody is on disability, they must have 100 employees or more for that individual to get a special enrollment period. If you are not sure if you qualify for a special enrollment period, I suggest you make an appointment or you call your local HICAP office to review if you are eligible for the special enrollment period. Because if you are not, unfortunately, you would have to enroll during the general enrollment period when penalties take place. Some of the penalties that take place for Medicare are lifetime penalties, and you want to make sure that you avoid that. And it all depends, but we would hope that you don't have to go through that. If you do, the general enrollment period takes place every year, January 1st to March 31st. You contact Social Security during that time and you can enroll into Medicare Part A and B. Penalties for A and B may apply, as well as penalties for Part D for your medications. So just be aware. Excuse me, not medication. Part D is prescription drug coverage. Excuse me. Next slide. So there are different parts. I mentioned a couple earlier right now. We're going to go into more detail. So when we refer to Medicare Part A, we're referring to hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans. And Part D are prescription drug coverage. Next slide, please. When we talk about hospital insurance, we're talking about people who are admitted into the hospital. If somebody's admitted at a skilled nursing facility, or somebody needs hospice care or home health care. When we're talking about Medicare Part B, we're referring to medical insurance, and this is the part that most people will be using. It's the doctor services, x-rays, lab services, preventive services, mental health, and durable medical equipment. For Medicare Part C, also known as Medicare Advantage plans, these are bundled plans that include Part A and B benefits and generally prescription drug coverage, and they're offered by private companies. Many plans offer extra benefits as well. And in order to enroll into a Medicare Advantage plan, the individual must be enrolled in Medicare A and B. And these Medicare Advantage plans are service area based, meaning that if you live in Orange County, you may have some plans available here. If you live in another county like Los Angeles, you'll have other available options in your local area. There is no automatic enrollment, and Medicare Advantage plans also have what is called special need plans. These special need plans are for people who have chronic conditions, who are institutionalized, or are considered to be dual eligible, meaning that the individual has both Medicare and Medi-Cal benefits. Now, plans may also include extras. These extras offered by the Medicare Advantage plans can include dental, hearing, vision, fitness programs, transportation, over-the-counter purchases, personal emergency response systems like Life Alert, Part B premium reimbursement, which can also be called reduction, rebate, or buy down or give back. In Orange County, in 2024, there are 24 plans that offer some level of reimbursement from $25 to $164 a month. Special supplemental benefits for chronically ill are also available. Examples of this are that some plans offer meals after a hospital discharge or home modification. So this is just something to consider. And then for those of you not familiar with Medicare Advantage plans, these are HMOs or PPO plans. They could be POS plans in your area as well. But in Orange County, these are all the HMO and PPO plans available. They're called Medicare Advantage plans. Part D. For Part D, we're talking about prescription drug coverage. So there are companies out there that will only cover your medications, and they're offered by private insurance companies. And we'll talk a little bit about that. Next slide, please. So before I move on any further, I just want to point out that Medicare itself does not cover dental, vision, hearing, or foot care, but a lot of the Medicare Advantage plans may offer this, as well as some of the supplemental Medicaps can offer some of this as well. Over-the-counter medications not covered by Medicare. Anything outside the United States may not be covered by Medicare, or long-term services and support, or long-term care. So when we talk about the coverage options in Orange County, we see that there are two options. Individuals can be enrolled in Original Medicare or on Original Medicare, or they can be on a Medicare Advantage Plan Part C. If the person is enrolled into Original Medicare, that person uses a Medicare card to go see their doctors. They will have another card for their prescription drugs or medications, and that person may have access to secondary coverage, whether it be a private supplemental coverage like a Medigap, or it could be on another program out there called Medi-Cal. So the person can be on Original Medicare, or the person can be on a Medicare Advantage plan. With Medicare Advantage, the person has a Medicare card, but the person doesn't have to use the Medicare card when they go and receive services. They'll be using the Medicare Advantage card that will be sent to them by that private insurance company, and they will use that one card for the hospital, medical, and prescription drug coverage. Now, beneficiaries will choose the coverage option that best meets their needs, so it just depends on what type of needs that person has. Some key considerations would be, for instance, some questions to ask yourself would be, what kind of flexibility do you need to see a medical provider that accepts Medicare? So what doctors do you go to, and what insurance do those doctors accept? Are you willing to receive services from providers within a defined network? Do you prefer to obtain referrals to see a specialist? Do you frequently spend time in areas outside of your local area? And another important question would be, what are your budget needs for funding medical and prescription drug related costs? So the financial aspect is also important in deciding this as well. Next slide, please. Now, once somebody is on Medicare, that individual will have an opportunity to make changes. And there are different periods in which somebody can make a change. But right now we're going to focus on the first one is the annual election period, also known as open enrollment. Next slide, please. So for Medicare open enrollment, takes place October 15th to December 7th. It's for anybody who is on Medicare. They can make a change or they can enroll into a Medicare Advantage Part C plan or a Medicare Part D plan. That's when they can make changes. There's a second open enrollment called Medicare Advantage Open Enrollment Period, and that takes place January 1st to March 31st, and it's for any individual on a Medicare Advantage plan starting January 1st. That person can change plans to another Medicare Advantage plan of their choice or go on to original Medicare by signing up on a Part D plan. Then we have what is called special enrollment periods. People's insurance can change from time to time. So anytime a person loses other medical insurance coverage, like employer group health plan coverage, that person may be offered a special enrollment period. If a person relocates to a new service area, that person may have access to a special enrollment period, and other situations will apply. Next slide, please. So I just wanted to let you know that if you ever need help with some of the costs for Medicare, HICAP programs are able to help individuals understand how they can save money. Next, please. So there are some ways in which somebody can help save money when they're on Medicare plans. First off is to do an annual checkup on their plan, make sure that their drugs are going to be covered for next year. This is especially important as the new year is coming up. Every year there are changes, and so you want to make sure that you keep current. Patient assistance programs may be available that can help save you money. You need to talk to your provider if you can take generic or if you must take brand. Mail order or ordering larger quantities instead of a 30-day supply, you get a 90-day. That can sometimes lower cost. Tiering exception, if you need help with an appeal for one of the medications to lower their drug coverage, you can ask for an exception, a drug exception. And then there is a federal program that can help pay for most out-of-pocket Medicare prescription drug costs, and that program is called Extra Help. It's also known as the Low Income Subsidy Program, and HICAP is available to answer your questions if you have any on this. All right, next slide, please. You can also get help with your Part B premiums if you qualify based on your income. And the program is called Medicare Savings Program. It's administered at the county level. In Orange County, we call it the Orange County Social Services Office. It may vary depending on your area that you live in, and it can cover the Part A and Part B premiums. It can cover deductibles, co-payments, and coinsurance, and there are multiple programs available. Income limits apply. Next slide, please. And right now, we just want to make sure that everyone is aware that you want to be wary of anyone who's trying to pressure you to enroll or change your plan. Be wary of anyone who's offering you gifts in order to enroll in a plan. That is a red flag. If you work with the broker or agent and there's misconduct, you can report that to Medicare if you'd like. You can also call HICAP and we can work with you if there's been misrepresentation or misconduct. TV ads, be very careful what you see on TV, or if there's a TV ad that says "Get all your benefits now," or "Activate your Part D, activate your Part C. You want to be careful if you do enroll in a new plan, your old plan can get canceled. So you want to be aware of that. And then treat your Medicare card like a credit card. So you don't have to show your Medicare card to anybody. If you're attending health fairs in the community, you don't have to take your Medicare card out. And don't be giving your Medicare card over the phone to anyone you don't know. So if it sounds too good to be true, it probably is. And make sure you do your homework before you enroll in a new plan. Next slide, please. These are some phone numbers that we have up. And while I answer your questions, we'll make sure to leave the HICAP phone numbers up if you need to use our services. And we'll be inputting some links into the chat box, which you can use at any time to contact the Orange County HICAP office. Or if you need to contact Medicare directly, we have the Medicare.gov website as well. Next, please. And everyone should have gotten their Medicare New Handbook. If you're already on Medicare, you're going to be getting the 2025 edition. If you need help with any Medicare-related question, the HICAP number is on the back of the Medicare New Handbook. Next slide, please. I thank you for your time, and I'm just going to check in with Peter to see if we have any questions for today.
Thank you, Beatrice. So far, no question coming in yet from the audience. And then thanks again for the presentation. That's a lot of information. For me, I learned a lot myself, and some of them are kind of refreshed, but some of them kind of new. I didn't aware of certain thing. Um, so maybe a question come to me about HICAP is, um, and please clarify if you already said that in the presentation. Is the service completely free to the community?
Yes, all HICAP services are free and unbiased. We don't sell anything, and we're here to help the community with their questions on their Medicare benefits. And if they have Medicare and other insurance, we can help people understand how that coordination of benefits between two insurances work together.
Excellent. What is the turnaround time to connect with a HICAP counselor?
Well, in Orange County, we have our call center in Irvine, and we are able to take calls Monday through Friday, 9 a.m. to 4 p.m., and people can um, call us. Usually, we have people available to answer the phones as they're coming in, so we take live calls, and you will be able to hear back from us within 1 to 2 business days.
Okay, that sounds good. Um, from your end, you have any kind of question that people are typically asking that you can also kind of share quickly with the audience?
Well, something I just wanted to tell people once again is that we're getting ready for open enrollment. So a lot of people who are on Medicare already have the ability to change plans if they want to change plans. And this is where people ask us a lot of questions about the upcoming year. So I just want to make sure that people are aware that it doesn't matter what insurance plan you have, your current insurance plan will be contacting you and you will be receiving an annual notice of change. It's a document that they will be receiving from the insurance company telling them about changes for next year. I just want people to make sure that they're opening their mail and keeping current on the changes. And if they have questions on whether or not their drug coverage will be, what the drug coverage will be for next year, HICAP is offering additional services in the community during open enrollment. In Orange County, we call them annual enrollment clinics, open enrollment clinics, where we will come in and talk to people. We go on the Medicare.gov website and provide a drug comparison, an annual plan review to see what the costs will be for next year. And people will be able to sit with us one-on-one and discuss what the cost change will be, if there is any, and how it would compare to other plans in the area.
That is
So
wonderful.
people have questions, please give us a call. If people want to see us in person, we are at different community centers. They can call their local community center in Orange County or give us a call, go onto our website, and they can find a list of site counseling appointments available.
Thank you, Beatrice. And as a family caregivers, I believe that sometimes it will be a lot on your plate to navigate, and if Medicare for your loved one or for yourself is maybe confusion to you, and you're not sure about how to go about that, please contact HICAP for the free service unbiased counseling on how to understand your Medicare benefits, and then basically to guide you to make the decision that you want, again unbiased, that you don't have to worry about going to certain company or whatnot. So again, the contact phone number is on the screen here, so you can kind of take maybe a picture of it, save that, and then call HICAP for services and support relating to you or your loved one Medicare benefits. Anything else, like last word you want to share with the audience up here? Just
No, just thank you, Peter. Thank you, Caregiver Resource Center OC, for having us on today. We appreciate our partnership. And yes, if anyone has any questions about Medicare, whether they're 65 or not, just give us a call. We'll be able to answer them. Thank you.
thank you so much. So thank you again, everybody, for your time participating in today's live stream. We will return to you in next month live stream with another topic to be disclosed later. So thank you again for your time and have a great afternoon, everybody.